It is my great pleasure to introduce our commencement keynote speaker, Dr. Margaret Hamburg. Trained as a physician and scientist, she chose to apply that training in service of the public health in a succession of ever more demanding positions. Following completion of an internal medicine residency, she went to the National Institutes of Health, where she served as assistant director at the National Institute of Allergy and Infectious Diseases. Upon her return to New York City, she became commissioner of the Department of Health. In that position, she confronted twin epidemics of HIV and tuberculosis. In 1997, she was appointed by President Clinton Assistant Secretary in the Department of Health and Human Services. Then, in 2009, she was appointed to her current position as Commissioner of the Food and Drug Administration, arguably one of the most challenging positions in the federal government, with responsibility for protecting the public safety while simultaneously facilitating approval of safe and effective drugs and medical devices. She has brought her extraordinary combination of intelligence, energy, and dedication to this critical job, defining what it means to be an outstanding public servant. We are fortunate to have her here with us today to share her thoughts with our graduates, their families and friends, and with the entire Einstein community. Dr. Hamburg.
Dean Spiegel, members of the Board of Overseers, distinguished faculty, parents, families, and friends, I join all of you in congratulating the outstanding 2012 class of the Albert Einstein College of Medicine. Let me begin by thanking you for including me in this wonderful event. But I think it is also a good time for this year's graduates to say some thanks as well. First and foremost to your families, especially your parents. They've stood by you, they've supported you, and today they share your joy, excitement, and pride. They do deserve it. Thank each other as well, because you would never have reached this auspicious day without the friendship, support, and collaboration of your colleagues. And thank your professors, the faculty and staff who put so much time and effort into teaching you, guiding you, inspiring you, and yes, sometimes prodding you. Whether you're receiving an MD, a PhD, or one of 15 physician researchers earning both, you're graduating from an extraordinary institution. Einstein is one of our nation's best and largest medical schools, dedicated to cutting-edge science, innovation, and biomedical research. But Einstein is more than just about medicine and science. This school is dedicated to the development and education of physicians and researchers who embody the highest standards of ethics and compassion. As your motto says, Einstein puts medicine at the heart of science. And the class of 2012 has certainly proved that. I know that most of you have been involved in community outreach, in the Bronx for sure, and some of you have taken your skills and passion for health across many continents and into some of the world's poorest corners. In doing so, each of you have embodied Albert Einstein's vision that concern for man and his fate must always form the chief interest of technical endeavors. For that, you all deserve respect and appreciation. And as I look out from this podium, I see a group central to the future of medicine, science, and the health of the public. And if I think back far enough, I can even remember being just a bit like you. I love coming back to New York City. I wasn't raised here, but I feel deeply rooted. I did my medical residency here at what we then called New York Hospital Cornell, and I did research at Rockefeller University. And then, as you heard, after a stint at the National Institutes of Health down in Washington, D.C., I came back to New York to serve as the city's health commissioner. That job and others taught me that learning never stops, and neither will the opportunities that come your way to make a real difference. There is perhaps nothing more wonderful about the careers that you're embarking on than that. It may be bad form at a medical school commencement to quote a lawyer, but exactly 128 years ago today, so I couldn't resist, the great 19th century jurist Oliver Wendell Holmes said to a group that he was addressing, "It was given to us to learn at the outset that life is a profound and passionate thing. This is a truth that you've been taught by your outstanding faculty, your studies, and your patients. And you now belong to a very elite group that has the tools and the training to improve the lives of so many. Whether it's through research or medicine or public service, what you do will really matter. Your adventures in the vast realm of science, medicine, and health, whatever your path, are just beginning. When I was at that stage, I wanted to be an academic physician. I would do teaching, I'd do research, and I'd treat patients. And my intended field, Dr. Spiegel, was endocrinology. I was certainly not planning a career in government or public service. And I would have bet large sums of money that I'd never become New York City Health Commissioner or the Commissioner of the FDA. After all, who would be so foolish? But over the years, I've learned that the old Yiddish saying is true. People plan and God laughs. Doors open, often unexpectedly. And when they do, you should walk through them, using your innate talents and the skills you've learned to make a difference. My first big career milestone is the same one that many of you are about to reach, my internship. It was a daunting prospect, but as I look back, my year as an intern probably did more to shape me as a doctor, professional, and a person than any educational experience before or since. Being an intern is hard, you work long hours, and it's scary. You never know what situation will have to be managed, who's going to be presenting with what symptoms, but now you're the one wearing the name tag doctor. People look to you with new expectations, but there were many days and nights when I felt like I was walking a tightrope, and my fellow interns felt the same. We knew we were making imperfect decisions with imperfect knowledge. We knew we were doing our best, and that sometimes our best might not be good enough. So the first thing I learned was humility. Back when I was in my first year of medical school, my classmates and I were taught that thanks to the advent of antibiotics and vaccines, we were on the threshold of ending the era of infectious diseases. But in stark contrast, as our medical education advanced, we watched with dismay as a mysterious new illness emerged. No one knew what caused it, no one knew what to call it, and no one knew how to care for it. It was the start of the HIV/AIDS epidemic. By the time I was an intern in New York City, I was taking care of many AIDS patients, but we had no effective treatments and no medicines on the horizon. We could offer neither cure nor hope. For a young, idealistic doctor like myself, nothing could have been worse. But the early days of AIDS brought many lessons. It opened my eyes to the importance of research and global health, the need for an integrated healthcare system that harnesses the full continuum of medicine, science, and public health, and that some of the greatest challenges in medicine exist at the interface of a broader set of social, ethical, political, and legal concerns. It was humbling indeed, but my experience as an intern also taught me to remain optimistic. It taught me that I was capable of stepping up and taking responsibility. It taught me to ask questions and to trust my instincts. It taught me to listen, to think through problems, and to defend my decisions. And perhaps most important, it taught me that no matter how difficult the night, the morning always comes. In other words, I learned I would survive and even thrive, and I want each of you to know that you will too. with both the anxiety and the feelings of accomplishment that come with being a young doctor or researcher, really have not changed much since I was a student. The practice of medicine and the role of public health agencies certainly has. One big reason is the new technologies, ranging from electronic medical records and imaging tools to gene sequencing, new diagnostics, and of course the widespread availability of all kinds of information. But there is no substitute for human instinct and compassion. Patients do not put their trust in machines or devices. They put their trust in you. We think of medicine as a science, and it is. But medicine is also very much an art, practiced by doctors who bring to the bedside not only their technology and training, but also their humanity, their caring, their concern. You've already spent years studying, training, doing research, and seeing patients, and likely you have many more years of education before you. But please remember that the more skilled you become, the more specialized, the more dependent on technology, the easier it is to lose your humanity, forget your compassion, and ignore your instincts. This is true whether you spend your careers as practicing physicians or go into research, teaching, public health, or government service. So while seizing the future, I hope you'll never let go of the past, the abiding tradition, centuries old, of building the bond of trust and confidence that lies at the heart of medicine and science. And that trust and confidence must be earned every day. And a few other words of advice. Be transparent in your dealings with patients and colleagues. Be thoughtful and judicious. Don't hide mistakes, and don't be afraid to ask questions. And follow the science wherever it leads. And I want to expand on that last point. Every step in my professional journey has reinforced my belief in the importance of evidence-based decision-making. As an intern and a resident, as a researcher at NIH and at Rockefeller, and as New York City's health commissioner. And it is certainly true today when I direct the world's leading regulatory agency. One of the things I've learned as the head of the FDA is that it is very difficult to satisfy all of the competing interests. Whatever I do, someone is always unhappy. So whenever I make decisions, I ground them in the best available science, even in the midst of complex social and political challenges. But trust and confidence and good decision-making also demands that you listen carefully, prepare thoroughly, and weigh the risks and benefits of your decisions. And one last piece of advice for gaining trust and confidence: hold on to the moral compass that has guided you to where you are today. As future doctors, scientists, and public health officials, much will be expected of you. That is why I urge you to recognize that with your training comes a broader responsibility. William Butler Yeats wrote, "Though the leaves are many, the root is one." I hope each of you will always remember that while the leaves of medicine are many, the root is one, and that is the moral imperative to advance human health. Whether you're treating individual patients as practicing physicians, delving into the mysteries of life, as a bench scientist, learning which therapies work best for which diseases as a clinical researcher, or addressing the broader issues of public health and health policy as a government official, you have the opportunity and responsibility to be part of a whole that's greater than yourselves. In fact, the best way to address the needs of patients, the best way to make important advances in science, and the best way to improve the health of a community, of a nation, is as part of a team. AIDS is now a chronic manageable disease, not a life sentence, because the entire healthcare system worked together, from AIDS workers who walked the streets giving out accurate information and urging people to be tested, to doctors and clinics and hospitals who provided care and studied the disease, to dedicated and brilliant researchers in both government and private and academic labs. So no matter where your career takes you, I hope you will always focus not just on the individual patient or research finding, but on the root, which is the imperative to advance human health for all. I hope you will speak up on behalf of America's uninsured, nearly 50 million as of 2010, many of whom, as you know, end up in hospital emergency rooms sicker than they need to be. And I hope you will always see yourselves as part of a team and dedicate yourselves to collaboration, breaking down barriers and staying true to science, forging new partnerships and building bridges that can span the broader social, legal, political, and ethical issues that surround health and health care. The practice of medicine and biomedical research has never been more promising, more exciting, and more fulfilling. From sequencing the human genome, to eradicating smallpox, to curing some deadly cancers, to effectively treating HIV infection, much of what is possible today was unthinkable or at best aspirational when I was in medical school. Huge progress has been made, but we still have a long road ahead of us. Emerging infections and drug-resistant disease, the growing burden of chronic diseases, including the epidemics of obesity and diabetes, neurodegenerative conditions, and the mounting problems associated with our aging population, importantly including Alzheimer's disease, environmental health concerns, and the list goes on. We have no time to waste. That is why one of my most important goals as Commissioner of the Food and Drug Administration has been to help translate advances in science and technology today into the treatments and interventions people need and count on as swiftly and as surely as possible. Toward this end, I focused considerable attention on building the field of regulatory science, the knowledge and tools needed to enable an efficient assessment of safety, efficacy, quality, and performance of medical products. This is vital to advancing biomedical innovation and finding new treatments, prevention strategies, and cures. But there are other challenges. An unfortunate reality of the 21st century is the fact that even when well-established therapies exist, they're often underutilized or unavailable, especially in poor neighborhoods, rural communities, and tribal lands, not to mention impoverished nations. The reason is almost always cost, access, or both. The Affordable Care Act will not solve the problem of cost and access, but unless rejected by the Supreme Court, it will certainly help us address a set of critical needs and extend health care to millions of Americans who are currently uninsured. The quality of our health care is another 21st century challenge that awaits your skills, passion, and teamwork. Yes, we have the best trained doctors, the most innovative researchers, and cutting-edge technology. But even in the United States, there are marked disparities and gaps in the quality of care. And in many places around the world, healthcare isn't just low quality, it barely exists. We cannot solve these 21st century healthcare challenges if each of us stays inside our preferred field and fails to understand that the solutions lie in work across disciplines, across sectors, across borders, and that they are not someone else's responsibility. The responsibility for finding answers to today's challenges belongs collectively to us. The 21st century medicine is both a miracle to behold and a mountain to climb. The path is not easy. We have before us complex, multifaceted, often deeply ingrained problems, and the only way to solve them is through collaboration, with science and best practice as the guide and a moral compass to hold us steady on course. We struggle with these issues every day at the FDA. We must deeply understand the science and technology that comes before us, spanning different disciplines and different interventions. We must work across sectors, be responsive to an array of stakeholders, and we must be mindful of both unmet medical and public health needs and unfulfilled opportunities for action. We must recognize the broader policy implications of our work, and we must understand that we have a collective responsibility to earn the trust of the American people every day. This is especially important for a regulatory agency like the FDA that is mandated by Congress, instructed by science, and obligated by mission and conscience to always protect and promote the health and well-being of our citizens. So as I reflect on the import of the transition today's ceremony marks, I am reminded of the Diary of Anais Nin, a popular book during my college and medical school years. She says many wise and wonderful things in this book, And one of my favorites is this: life shrinks or expands in proportion to one's courage. This is a great lesson, no matter where you are in life or what career choices you make. I hope you will always combine the skills you've learned here at Einstein with the courage of your own convictions, to be great doctors and scientists, to be a voice for those who are in need or underserved, and to serve the cause of medicine and humanity, helping to shape the future for us all. So congratulations, class of 2012, and good luck to you.
Dr. Hamburg, thank you for this wonderful talk. Perhaps I have this garbled, and if I do, I don't doubt I'll be barraged by dozens of emails correcting my error, but your quote of the jurist Oliver Wendell Holmes reminded me of a related Oliver Wendell Holmes, had another quote attributed to him, which was something about if all the materia medica, that was the term for drugs in the 19th century, were dumped in the ocean, it would be the worse for the fish and the better for mankind. And my impression is that you and the agency staff that you lead work tirelessly to make sure that for the public in the US and indeed around the world, the materia medica of the 21st century are indeed beneficial for humans and not necessarily for fish. So as a token, appropriately limited in value to conform with federal guidelines on receipt of gifts. But our appreciation for your being here with us and sharing your insights is truly unlimited. Thank you so much for this talk, for sharing this important time with us, and I speed you back to do the important work that you're doing. Thank you.